quite quickly, because I suppose what we're really keen to do is have the discussion afterwards, and what you've heard from Mimi and Kevin and from myself about maybe what's next steps and where we go next. As introduced, I'm Gary Maxwell. I work in the Health Development Policy branch in the Department of Health, and work for Liz, and in my branch we have responsibility for obesity prevention. We also have alcohol and drug misuse, and making life better, which is our overarching public health strategy. So not busy at all, nice easy problems to solve. It certainly keeps us on our toes as we work through this. So I mean, people will be aware, obviously, you know, obesity we measure primarily through BMI, body mass index, and BMI of 25 to 30 is obviously overweight, and 30 plus is classified as obese. And primarily we look at it as an energy balance, so where people take in more energy through the food and drink that they consume rather than the physical activity and body processes that they take through that can increase obesity over time. And I think, you know, building on what we heard today, traditionally obesity and related diseases like diabetes were seen as later diseases of life as people move through their lifetimes. These come in later, but we're increasingly seeing them, you know, in younger people, and again type 2 diabetes again among younger people. So it really is a key issue that we need to be looking at. I've put up there just the prevalence of obesity in Northern Ireland as we stand. So really, if you look, about 2/3 almost of our adult population are either overweight or obese. And for children and young people, it's around 1 in 4, which is around the same as across the rest of the UK and around those levels. I suppose that, as we've already heard this morning, the children figures are particularly concerning. As people have said, the health impacts of obesity build up over the years, and so we need to support our children and young people to behave more healthily. I'm trying not to use healthy choices now. I feel like I've been chastised. I'm trying to think of a better term as we go through. So if you see me thinking about terms as we go through, that's what's happening. And also, as others have said this morning as well, that obese children are more likely to become obese adults, and children of obese parents are more likely to become obese. So therefore, we do have this spiral of increasing obesity as it goes through. And it's not just about physical health. It's about mental health, about well-being, about emotional health, self-esteem, particularly among our young people. And I think, you know, obviously overweight and obesity can also be stigma for children at schools and bring other negative social consequences with it as well. And as other people touched on, I think there is really a clear health inequality with overweight and obesity as well. Those living in the most deprived areas are more likely to be overweight and obese, and are more likely to suffer harm because of it as well. So it's something we always need to bear in mind as we look to address this issue. I'm looking around the room. I don't think anybody was there when Fit Futures came out. Is it just me? Karen, were you there? There we go. We go back. So it is not new. We've been working on this quite a while, and the Fit Futures Task Force was actually established. It scared me when I read this in 2004. To start looking at addressing overweight and obesity amongst our children and young people, and established then by our ministerial group in public health that existed at that time. And the task force's role was to examine options preventing overweight and obesity, children and young people, and to make recommendations. It was finally published, that report, in 2006, and it made 70 recommendations at the time to take forward action across a range of issues. What we did subsequently was establish an obesity prevention steering group to look at addressing obesity, not just amongst our children and young people, but right across the life course, sort of recognising those intergenerational impacts that people see. So that's our current obesity prevention strategy, A Fitter Future for All, which was launched in 2012. And it was developed by stakeholders in the public, private, community and voluntary sector to really look at addressing obesity across the life course. The strategy aims to reduce the level of harm related to being overweight and obese by creating environments that support and promote physical activity, physically active lifestyles, and people to eat a healthy, nutritious diet. It is focused on prevention and early intervention. It doesn't really go into issues around bariatric surgery and interventions. And I think if we did look at that approach, all our money would go into surgery and treating people in hospitals, and actually we wouldn't be turning off the tap that flows people through the system and into needing those types of interventions. I think it's important to note it does focus on physical activity and diet and nutrition. And actually, there's actions in there that aren't just related to obesity, recognising the wider impacts of both food and nutrition and physical activity on health more broadly. So it's still in place. We continue to take it forward and implement it, and we've experts in the field on the steering group from the Food Standards Agency, Safe Food, the Institute of Public Health, University Council's Public Health Agency. Never really managed to get service user involvement. Bit of a tricky one in terms of public and patient involvement in this area and how you identify people. So if anybody has any ideas about how you service user involvement in this area, I'd be grateful to hear those in our discussions. We set ourselves very ambitious targets, I think, at the time. Previously, targets before that had simply been to stop the rise in levels of obesity. And we set targets to reduce obesity amongst adults by 4% and overweight and obesity by 3% by 2022, and among children a 3% reduction in obesity and a 2% reduction in overweight and obesity by 2022 as well. And obviously as people move from obesity, they're going to fall into the category of overweight and obesity, and that's why there was 2 different targets set for those. So we publish annual reports, and the link there, the most recent one, is on the screen, and I'm sure we'll maybe circulate these afterwards if people want to click on the link and go through. So that's for the year 16-17. We're working on a 17-18 report at the moment and hope to publish that later in the year. So the key areas the strategy sort of currently focuses on, and I suppose being a prevention strategy at early years is kind of a no-brainer to start from, and where our main focus is. I think the evidence does clearly show that focusing on the early years age group has a real chance of having an impact, getting the biggest return on investment, and going right then through people's lifetimes. And I suppose touching on what Mimi was talking about around healthy choices, we also clearly recognise the impact of the obesogenic environment. So the environment we live in, food, activity, work, entertainment, leisure, is increasingly supportive of lifestyles that actually aren't healthy, and that promote overweight and obesity. And so therefore it's important that we not only work with individuals and talk about individual choices and healthy choices, but actually that we ensure that people are in environments that support those healthy choices and actually make healthy choices easier choices. That's not easy to do, but we'll talk about more of that as we go on. We also do work with key stakeholders, and I think in this area we do need to work with the food industry and others to try and improve the foods we're seeing. Planning is a big issue, local government, schools, employers. Again, trying to amend that wider environment and just not putting the emphasis on people taking individual responsibility, but there is a responsible bit to it. And I think we also need to recognise that yes, we can give people the skills and the knowledge, but actually skills and knowledge enough doesn't change behaviour. And not only do we need to have an environment that supports healthy choices, but we also need to make healthy choices the sort of fun, inspiring. People want to take those healthy choices because they are good to take and good. And I suppose it's countering some of those messages that the food and other industries put forward about the unhealthy foods and the good outcomes from those. So how do we make them more interesting and more inspiring to take? I've put up just some of the key actions that we're taking forward. This is for the sort of conception up to 5s, and I suppose one of the big issues is obesity during pregnancy, and the Way to Healthy Pregnancy programme has been really good in terms of targeting that particular vulnerable group. And fortunately, over the last few years, we've been able to invest a little bit more in that and reduce the threshold for women accessing that important service. Breastfeeding and weaning, also a key issue around developing good habits early. So we've some key actions around that in our strategy, but also then in a separate breastfeeding strategy that takes a wider approach to that. It's also important, I think, that childcare settings, both formal and informal, provide supportive environments for people to be active and to eat healthy food. And there's a lot of work going in and around those settings at the moment. And again, sort of ensuring that the parents have those practical field skills and knowledge and awareness to actually deliver that at home. And actually, I suppose, increasingly thinking about guardians, kinship care, grandparents, all those people who are increasingly taking those key roles around caring for children and making sure that they understand that treats aren't every 2 minutes, and if you went with my children, they ask for them constantly. I'm now taking an approach that if you ask, you don't get. You might get a treat if you don't ask, and it might come eventually, but the pressure is there, and grandparents, I think, are particularly feel that when looking after children. Children and young people then obviously as well is a key section and key theme in the strategy. And again, we've a range of outcomes focused in that setting, particularly around schools, because obviously that's where most children spend the majority of their lifetime. and it's really important that schools signpost that healthy lifestyles and encourage people to be more active. And then by bringing children on board, they can influence their parents and carers and guardians as well, as we've all been lectured, I think, by some point by our children around these things. So I think that's an important way to set through the whole life. Physical activity along with play, recreation, sports, team events benefit from developing physical and social and emotional skills, and can improve self-esteem, relationships, and increase confidence and resilience as well. So broader impacts as well beyond just healthy weight. And again, that can tackle that through the party, throughout the family. I think sort of the last two, the physical activity guidelines and the active travels in schools, is important because we need to build activity into daily lives. I think if we just expect that we go to set occasions where people are active or set events, it becomes a completely different approach. I think we need to use things like just making sure that people are active or walk to school or cycle to school, build in everyday approaches, or else we'll not start to change the tide. Yeah, and obviously getting parents involved in taking their kids to school is important too, and can influence the family and our communities. You'll never be able to see that on the screen, it's quite small, but those are the CMO physical activity guidelines, on the left for birth to 5 and on the right for 5 to 18-year-olds. And again, I think it's just emphasising the point that physical inactivity is the fourth largest cause of ill health in the UK. With negative impacts on health, social, economic outcomes for individuals and communities. So it's again important to build that physical activity in, not just because of healthy weight, because of those wider impacts. These physical activity guidelines were developed by the 4 UK CMOs in 2011, and the infographics that are on the screen were produced more recently, and I think the young people was the last one to come out. But obviously the evidence has changed a bit over the time. So currently, the 4 UK CMOs have commissioned a piece of work to look again at the guidelines, and it's hoped that those will be published by the end of the year. And one of the key focuses of that is actually to make them more public focused. The infographics were quite focused for health professionals and those working with young people, and that's good and useful and was fine. But I do think we need to be better at getting these messages out to the public. And while those are quite good infographics, they're not the easiest digestible in a short period of time. If you get 10 seconds to engage with a member of the public on, I don't think that's necessarily the best way of doing it. So I think that public focus is important, and build our learning there. They'll also cover issues around screen time, sedentary behaviour, those kind of emerging issues that we're seeing as well. So implementation, as well as our obesity prevention steering group, we have a ROPIG, as we call it, our Regional Obesity Prevention Implementation Group, chaired by the PHA, and really it takes forward a range of actions that aren't being delivered by government departments, and it's the key kind of group for coordinating, collaborating, and taking forward actions collaboratively together. So, activity, lots of it. We're doing lots of things. We've lots of actions. We're delivering on them. Progress is pretty positive. There's 50 actions in the strategy, and 88% of those at the last update were on track for achievement, with a small number that we are taking forward, but there is a slight delay, and nothing at this stage is red in terms of not getting any activity. And I sort of mentioned key progress around active travel to schools and keeping that programme going to 2021, and building the daily mile into that, which is the walking children around the school every day. Play sessions, Playboard and others, working with local councils about delivering those, delivering nutritional information sessions for youth groups, and the ongoing development of Cook and rollout of that. Kids in care, working with one of those vulnerable young groups, about ensuring kids in care have the skills to cook and when they leave care as well. And food in schools policy, a big one around making sure that the right food is available in schools. And actually, we're currently taking forward with the PHA, the FSA, and our colleagues in Safe Food, a programme to improve catering standards in the hospital settings, and make sure that we're actually living by the words we put out, and making sure that we are giving good standards to those. Interestingly, under that, we're taking forward a piece of work with the Innovation Lab in the Department of Finance, looking at behavioural change techniques, And I think that's important that we look increasingly how we build in those techniques that nudge and encourage people to make the healthy choices, not just saying by giving people information they'll make those choices. So that's a really interesting piece, and I think we'll be learning from that right across all of our sort of behavioural approaches once that starts to come out. So yes, there's lots of activity, lots of individuals are benefiting. All our programs and actions evaluate well, but actually what are we seeing in terms of population level indicators and outcomes? And actually not a lot, really, to be honest. Probably if you took these graphs, and this is just the children and young people's one, probably if you took them back from before 2010-11, you'd have seen the graph sort of rising to the point in 2010-11, and as Kevin sort of said, we are seeing some plateauing then of those figures and not really increasing since then. And a little bit of encouragement around fall and overweight amongst our children and young people, but not really seeing the movement we need to reach our targets, particularly in terms of obesity. And actually the inequalities have been increasing until the last report, where the inequality decreased slightly because we increased obesity in one of our more socially advantaged communities. So not quite what we were trying to do, but a good figure come out of it. But we just need to be careful of reading beneath some of the figures at times as well, and actually seeing what's driving the changes, as well as just looking at the headline figures. So I suppose the question we've been asking ourselves in the department and looking at is, are we really seeing the impact we would like to at this stage? Probably not. Why? So are we doing the right things? Are we doing them at the scale we need to do to have the impact at a population level? Or actually we are doing the right things, there is enough scale, but this is going to take 20, 25 years before we actually see these figures start to change. So we're starting to ask ourselves those questions as moving through the process. We're also sort of conscious of the environment that changed since 2012 and the different contexts that we now are working in. So looking against those questions about are we doing the right things, government departments and responsibilities changed in 2016. So we need to ensure that the appropriate departments are leading in actions, that they're aligning actions across their departments to get the best they can out of those and to get the most benefit. There is emerging evidence base and research from both Kevin and Mimi we've heard today. And so that continues to develop and evolve, and we need to ensure that it's reflected as we move forward. Community planning actually is a major change, I think, for us all since 2012, and it's really starting to develop now, and we need to ensure that strategically we're aligning what we're doing, from a government and arm's length body perspective with what the communities themselves are doing, and making sure that we're maximising those opportunities as well. There's also actions and strategies being taken forward in other jurisdictions, and I'll touch on those just briefly in the next slides, and Mimi has touched in chapter 2. What we've also seen is, I suppose, a change in government approach generally. So we had the draft programme for government and what's now the 1-year NICS outcomes delivery plan. And the key focus in that is around outcomes and measuring performance and measuring outcomes. And I think maybe by focusing on performance monitoring and looking at that key outcomes-based accountability question, is anybody better off? We might be able to better address the sort of dichotomy between all the actions we're doing and all the really good individual impact we're having and the population level. So I think that's something we need to bear in mind as we're looking at our actions going forward. There's another issue that I haven't put up for various reasons, but EU exit has the potential to have a really big impact on this agenda, particularly around the work the FSA do around labelling and food products and all that. So we need to bear that in mind as well. So yes, all the sort of neighbouring jurisdictions recently have developed new policies and strategies. In fact, England and Scotland have come out since June, so really fresh and new in terms of where they are. And we started a process to sort of try and map out where they all were and where the gaps were compared to what we were doing. And I was going to have a really nice, neat slide that showed what we weren't doing, but actually, when you get into the detail of it, they're all quite structurally different. They all have quite different delivery mechanisms, and there's no real easy way of mapping that out onto a single slide. But we are still using sort of all the actions and developments in those jurisdictions to inform what we're doing as well. And Mimi touched on this. I think we are particularly aware of the obesity chapter 2 that's being brought forward by the Department of Health and Social Care in England, and it does specifically raise the issue of advertising and promotions, broadcast advertising, as well as issues related to online advertising which fall within that definition are not devolved, so that does rest with the UK government. So its commitment to consult on introducing a 9 PM watershed on TV advertising of high-fat and salt-sugar products, and similar protection for children viewing adverts online will apply to Northern Ireland. And we're really keen to see that consultation and to influence it. We did have an action in our strategy about strengthening advertising and regulations around that, particularly to children and young people. And previous ministers have lobbied on that with not all that much traction to this point, so it's interesting to see that now is the point where we're starting to see that change. And I think Mimi's probably set out some of the rationale for why we're seeing the change in approach to that, and I think that's very interesting. The commitment in Chapter 2 also includes consideration of whether the current self-regulatory approach via the Committee for Advertising Practice and the Advertising Standards Authority continues to be the right approach. So again, I think that's really interesting and something that is UK-wide, and we need to be involved in the consultation when it comes out. And I'd encourage you to be involved in the consultation, because depending on whether or not we have ministers, our involvement in the consultation might not be too deep, because we can't take a policy position on issues, without a minister there. Although we have an existing policy, so we might be okay, I think. But obviously, if you've thoughts, I would really encourage you to feed those in. You might think it's England and it doesn't apply, but actually it will have an impact, so we'd be grateful for that. So I suppose what's next, and kind of moving into the discussion, I'm keen to think about how what we've heard today and can influence what we're doing, but also how people around the room can support us as well in what we're trying to do. So the strategy, while it was 2012 to 2019, isn't set in stone. It wasn't done once and never looked at again. We actually update our actions and short-term outcomes in a sort of 3-year rolling cycle. We plan to do that in line with budgets and budget cycles, but unfortunately that's not been the way it's gone. So it's still useful to have that frame, though, to look at actions within those 3 years. So the last set of actions ran from 2015 to 2019. So we're currently then looking at revising and amending the actions for 2019 to 2022. And apart from that, I'm not sure anybody else in the room was at our event. We had a workshop on the 12th of September where we ran through all our outcomes, all our indicators, looked at what was there, what needs to be amended, what the gaps were. And that really identified a range of ideas for us to look at as we go forward. We also need to start thinking now about post-2022 and maybe even moving to a model like England, where actually you don't really have time frames, you have chapters and you update it as things come along. I think that's an interesting approach and something we can learn from. So the discussions we're having currently will feed into what comes next, but also discussions from today, so really keen to hear people's views about what we can do. Also really keen to have people to think about how they can support us. So what do the people in the room, how can you help us, both individually but also professionally, how can you help us deliver on trying to reduce this key burden and the cost that Kevin set out for us all. That's a really quick run through.